The World Health Organization last week declared Mpox a global public health emergency. That's its highest form of alert.
Mpox, the virus formerly known as monkeypox, is spreading quickly around the world following a summer outbreak in Africa.
Mpox is not the new COVID.
Well, that's a relief. The WHO says Mpox is not going to hit the world in the same way as COVID. However, it is still calling it a global health emergency as the number of cases rise. And of course, it's worried also about a new, more virulent strain. People around the world have a lot of questions about this virus, and we're going to be putting some of those to our panel of scientists and doctors, including, can it be contained? How dangerous is it? And will there be a need for lockdowns or other restrictions? But first, let's have a look at how Mpox is being reported in the media.
The World Health Organization has declared a global public health emergency following an outbreak of a new strain of the Mpox virus in Africa.
A new variant of the disease with its distinctive rash has emerged in Central Africa.
This strain is more mortal, so in other words, causes more percentage of deaths. It's also more transmissible. It spreads more easily from person to person.
Detected in 13 African nations, including Kenya, Rwanda, and Uganda.
This is the second time in 2 years that the WHO has declared Mpox a global health emergency.
Sweden's public health agency says it has recorded the first case of a contagious new variant of Mpox outside the African continent.
More cases of the dangerous variant are likely to be found in Europe in the coming days.
It's clear that a coordinated international response is essential to stop these outbreaks and save lives.
We do not recommend closure of borders. We do not want to see closure of borders.
Mpox is a virus that's very closely related to smallpox and to chickenpox, and so it's very contagious.
Monkeypox is a zoonotic disease. This means it can spread from non-human animals to people.
It starts with flu-like symptoms and ends with this. This is what Mpox, which used to be called monkeypox, can do.
It's transmitted by near contact, and we have not that much information on how transmittable it is.
Most people can contract it through very close and prolonged contact with an infected individual, with direct contact and sexual contact. Those are the primary modes of transmission.
Having just had COVID and now getting monkeypox, how do you compare the two?
I was much sicker with monkeypox.
Okay, let's bring in our panel now, and we have two infectious disease experts with us, Dr. Samir Elsayed in Canada and Dr. Amesh Adalja in the United States. Welcome to both of you. Amesh, if I may start with you, this virus is not easily transmissible. So then what makes it a global health emergency?
Just because it's not as easily transmissible as COVID-19 does not mean that it can't be a disruptive force in countries in which it is spreading. And what's different about this is we've got a more contagious, probably more dangerous strain that's spreading unchecked in the DRC with spread to neighboring countries who have never reported Mpox cases. And what this public health emergency will do is galvanize the world to get resources to the source of Mpox, to be able to vaccinate populations, to be able to diagnose populations there, to reduce the risk in the whole continent, on the whole continent of Africa, as well as for the rest of the world, because there is a threat of importation of disease as people travel out of that outbreak region. So this really is about making sure that Mpox ceases to be a threat to Africa and to the world, even if it's not going to be a COVID level threat or a pandemic flu level threat.
And Dr. Elsayed, do you think it was the right decision to declare this a global health emergency?
Yes, I do believe it was the correct decision. Actually, Mpox has been neglected for many decades, and we've seen already from 2022 to 2023 with the clade 2 virus how it was spread outside of the African continent. But in Africa itself, it's certainly the number of cases this year exceed everything from last year. And for the last 20 years, Mpox has infected thousands of people. Since 2005, actually, it's been thousands of cases every year. And so with this more transmissible strain, with the neighboring countries of Africa that have never had Mpox before, as well as the case in Sweden, there's a case in Thailand currently being investigated. We won't know if it's clade 1b or not until Friday, but I do believe it's the correct decision.
And Dr. Adalja, do you think the World Health Organization should have made a similar announcement before when it was just contained within the continent of Africa?
I do think that this required a lot of attention in Africa, at least since the mid-2000s, when cases were spiraling out of control in the DRC, in places like Nigeria, and which seeded the prior outbreak that we had in 2022. You know, as the other guest has said, this has been a disease that's been on the radar of infectious disease experts for a long time, but has been neglected until it caused this major outbreak. So I do think that we should have been much more aggressive with controlling this virus at its source, at least up to 10 years ago, when people started to think about this becoming something different, that it was changing its modes of transmission, that it was becoming sexually transmitted. And we had vaccines, we had countermeasures that could have been deployed earlier. It's only now that we're actually seeing vaccination occurring on the continent of Africa. And I think that really speaks to the fact that there's a lot of inactivity and inaction and reactivity when it comes to infectious disease outbreak. But what we need is actually proactive steps. And I think this public health emergency declaration is the first time we've seen them being proactive, but it could have come earlier because this has been going on for some time in the DRC.
And do you have any suspicion why the WHO was dragging its feet?
I don't know that they were dragging their feet, but it is a bureaucratic process. This requires consensus amongst multiple different individuals on the emergency committee. Sometimes countries themselves are reticent to have a public health emergency declared within their own borders or affecting their borders because of the stigma attached to that. So there's a lot of considerations that go into these declarations that are outside kind of the realm of infectious disease and epidemiology. We saw that with COVID. We've seen that with Ebola. We've seen it when declarations are declared, when they're not declared. It's not, you know, as an on or off switch. It's not an easy process. And that's what happens kind of when politics and international relations get bound up in what really is a scientific issue.
It's not a question of the WHO thinking, oh, well, it's only Africa, let's not worry too much, but now it's reached Sweden and Pakistan, we need to ring the bell?
Well, I think that there is definitely much more impetus to declare a public health emergency when something spreads to the Western world, to more developed countries. That's always been the case, that's when people start to take action or take notice, because people often think of certain countries in Africa as places where infectious diseases kind of thrive, and that's always been the case. And I think that's the wrong way to look at it, because infectious diseases in one continent affect everybody in all the other continents.
Okay, Dr. Elsayed, Dr. Adalja there mentioned vaccinations. In fact, there is no vaccination against Mpox itself. Is that correct? But they found that smallpox vaccination is 85% effective.
Yeah, so there are 3 commercially available preparations of Mpox vaccine, actually 3 brand names. The one used in Europe is Imvamune, the one used in Imvamex, and the one used in Canada is Imvamune, and Jynneos is the one in the United States. These vaccines are essentially vaccines made against smallpox and cross-react to the Mpox virus.
And Amesh, we've received a number of questions from our viewers, quite simple ones, which I think, though, do need to be addressed. And they, chief amongst them are, can it be contained? How dangerous is it if you contract it? And will there be a need for lockdowns and any other restrictions?
So yes, this can be contained. We had outbreaks, for example, in the United States, where we had over 35,000 cases with the other clade of Mpox, and that was contained. We have countermeasures. As you've just heard about, there are vaccines that are highly effective. The key to containment is diagnosing cases, isolating them, vaccinating individuals that are in the at-risk population. So this isn't the same thing as COVID-19, which was a virus not known to humans before 2019, for which there were no countermeasures. We have countermeasures, and this doesn't spread in the manner of COVID-19 or influenza. So that's not something that would require major mitigation measures, like you mentioned, lockdowns. Those aren't anywhere, even in the realm of possibility when it comes to a virus that's spread through intimate, close contact like Mpox. And when it comes to COVID, you have to keep also in mind that those lockdowns only occurred because there was major inaction by governments. That's not the way you want to handle an infectious disease. That's a last resort when you've basically used up all your other resources. So although the people are really triggered by the idea of lockdowns because of what happened during COVID, you have to realize that's not anywhere in the first pages of any kind of playbook for an infectious disease. And it certainly wouldn't apply to a virus that spreads in the manner of Mpox, for which we have vaccines and countermeasures.
And Dr. Elsayed, on the question of how dangerous is it, what is the mortality rate and how effective are the treatments available?
Well, the mortality rate for clade 1 in general is much higher than for clade 2. The mortality rate for clade 2 is around 0.3% to, it's less than 1%, but for clade 1, and we don't know about clade B outside of Africa, of course, because we only have the Swedish case, but in Africa, the mortality rate is approximately 7% roughly. And so, that, of course, that's very concerning. The difference between clade 1A, which has been around for decades, and clade 1B, which is this new strain, is that clade 1B has a propensity to transmit between person to person. It's not considered to be a clade that was acquired from animals, whereas clade 1A is known for being transmitted from animals to humans, and also as well there has been some human to human transmission. But the concern is with the human to human transmission of clade 1 or subclade 1B, with that mortality rate of about 7%. There's obviously a range of numbers quoted. That's the concern, of course. And most of the people who are dying are young children. These are people that have never been vaccinated against smallpox, people who are over the age of 55, people who were born before 1970 are perhaps protected from previous smallpox vaccination if they received it. So,
and a quick question for you both, Dr. Elsayed. Let's start with you. There are questions why African countries themselves haven't prepared themselves for such an outbreak, given that it is endemic in some countries in Central Africa and in West Africa. Could those countries have done more to prepare?
I guess one of the challenges in Africa and other developing nations is access to resources and infrastructure of the healthcare system. Certainly, I believe the African CDC and other organizations have worked tirelessly to contain infectious diseases outbreaks, not just for Mpox, but also if you look at Ebola and many other diseases that originate on the African continent. I don't think it's a lack of effort. I think it's a lack of resources and a lack of international support.
Amesh?
This is something that's been a perennial problem, is that trying to make Africa resilient to the infectious disease threats that arise there. And that's been part of, for example, during the Obama administration, the global health security agenda was meant to increase the infrastructure in Africa. And we've seen with Africa CDC being developed some efforts to try and do that. But when you think about a country like the DRC, how it is plagued with conflict and authoritarian governments and civil wars, Mpox is probably far down on their list of threats to their country and their national security. So it's often hard for countries like this to be able to even develop the infrastructure or public health apparatus to deal with it. But this has to be something that is created there, because this is not going to be the last infectious disease outbreak that they face. And I think the whole world depends on this being the world itself being resilient in all of its corners. And I think this is a major priority to develop that capacity in Africa.
Dr. Amesh Adalja and Dr. Samir Elsayed, thank you both very much. Much appreciated. Well, it seems clear that Mpox is not the next COVID, but the WHO is still concerned about another pandemic coming along in the future. The question is, has the world learned how best to handle it? Remember, last time each country took a rather different approach.
Last time concerns over a virus went global, two starkly different approaches were put into effect. State-enforced lockdowns and public-led herd immunity. In other words, letting a significant portion of the population get the virus, becoming immune in the process. Sweden opted for herd immunity, avoided a societal shutdown, and asked vulnerable citizens to shield themselves if they felt it necessary. Very large gatherings were limited. According to the World Health Organization's data, Sweden's excess death rate over that period was 56 people per 100,000. Spain's excess death rate was 111 people per 100,000. That's double. Spain enforced one of the strictest lockdowns in Europe, ordering most of their 47 million residents to remain at home except to buy food or medicine, or walk the dog, giving more freedom to pets than those under 14, who were confined for over 6 weeks in their first lockdown. Sweden allowed people to keep their freedom, and still the death rate remained lower than many countries with extreme governmental restrictions. Lessons have been hard to learn because of the different ways data was collated both during and after the COVID pandemic. The UK employed a policy of recording any death within 28 days of a positive test as being caused by COVID. Even PM Boris Johnson was dubious of the figures.
He says, "I must say I've been slightly rocked by some of the data on COVID fatalities. The median age is 82 to 81 for men, 85 for women. That's above life expectancy. So get COVID and live longer."
The WHO is a long way down the road of planning for the next global emergency. Its pandemic treaty is centred around private business and political interests, leaving it hard for some to believe global health is their only motivation. The idea behind the treaty is to create a new system of pandemic management under the WHO's authority and make it binding under international law. Member states would be obliged to give up 20% of pandemic-related health products to other countries and would be prevented from stockpiling supplies. It was this issue and concerns over intellectual property rights and sanctions that prevented the treaty being signed in May earlier this year.
You give away power to people that can make huge decisions over your life, you can't vote for, you can't hold to account in debate, and you can't actually vote to remove.
So if the government decided on another lockdown, how would the general public react? We sent our producers onto the streets of London to find out.
Just wondering people's opinions on if there were to be another lockdown, would you comply with it?
No.
Why is that?
We went through this once in the US, and we're not going to comply. Don't trust the government.
Basically, so theoretically, if the UK government was to lock down again, would you comply with it?
Absolutely not. Those are the only circumstances I would form a revolutionary movement. I would die on the barricades for freedom and liberty. Never again. I couldn't bear it. It would be awful.
I think that was what we needed. So I think the lockdown gave them some time, but I don't know if we'll be able to do that again. I think it affected us a lot and it affected our economy a lot as well. So I'm not sure.
Absolutely, because it would be legal. It would be the law, so therefore you need to do what the law requires you to do. Although that hasn't always followed for our politicians, it should certainly follow for us.
I don't think I would. I don't think
Probably
I would.
not.
So if the government locked down the country, would you listen?
I don't think so. No one's going to listen to them. It's just a game. There is no COVID, nothing. The government, they just make out of their hand. They just make the people to stay at home. They show their power. I think that's what they're doing.
If the government hypothetically was to lock down again, would you comply with that?
No.
Why is that?
Because it's a bioweapon, just like the last one.
I think that if the populace voted, whether that was a short or a from-home vote, whether they were in favour of, as a majority, in favour of locking it down again if something happened, I think that would be a democratic solution to probably a difficult problem.
Yeah. OK, let's bring in Anthony Hinton now, a former NHS surgeon here in Britain. And we also have Rodney Roy, a microbiologist in the United States. He also used to work with the Centre for Disease Control. Welcome to the programme, both of you. Tony Hinton, if I may start with you. Quite a lot of scepticism there amongst our Vox Pops about the efficacy of lockdowns. Do you think they have a good reason to feel that way?
Well, we've just been through a pandemic and we had a huge worldwide experiment with lots of countries doing different things. And what I would say is that we should be looking at which countries did best and did best in the long term, particularly in terms of overall mortality, and the country that did best is Sweden. Now, Sweden had almost zero lockdown. I visited Sweden twice in the autumn of 2020 to see for myself. They didn't have groups of more than 500 people, so cinemas and theatres were closed, but otherwise everything was normal. There was no masking, shops were open, restaurants, bars, it was very normal. And I think we should learn from that. So there's no evidence that lockdowns saved a single person, but there's a lot of evidence that lockdowns have caused huge problems, children's mental health, the economy, health in general, missed cancer diagnosis. You could go on.
Rodney Roy, your response?
Yeah, I mean, I tend to agree with that statement with just some caveats. I think it's difficult to take one country such as Sweden or Spain or even other countries and compare them to a very large continental country like the United States, including just differences in how people's belief systems work, how they actually follow these types of public health measures. But ultimately, I do think we have some absolutely important lessons to consider. For example, perhaps different countries can approach this in a way that makes more sense from a very honest and accurate science communication standpoint. My perspective is that we did a really poor job in the first 1 to 3 months. We also have to remember we had a novel agent that we didn't know a lot about. And so I think we didn't really do a good job of communicating that we would learn in real time and that we would adjust on the fly. And I really think that was part of the global problem, including in the United States.
Anthony Hinton, let's move on to the WHO, which wants a global pandemic treaty. What are the upsides and downsides of that?
Well, if the WHO had been in charge of pandemic responses in the last 2 to 4 years, every country would have done the same. We wouldn't have differences to look at now and see which was the best way forward.
Rodney Rohde, would you be in favour of the United States signing up to a global pandemic treaty drawn up by the WHO?
I think only in the sense that we are globally communicating and working towards the best solutions and best information. I can't speak for the United States government, of course, but certainly I think that we would want to be communicating and want to be working with everyone across the global spectrum to decide best evidence, best practices, and so forth, including, again, communication.
Come in, Tony.
I would absolutely agree with that, really. One of the big problems at the start of this pandemic is that anyone that raised anything that wasn't in the government or the medical hierarchy's narrative was censored and vilified, thrown off Twitter. One good thing that's come out of the UK's COVID inquiry is the suggestion that there should be so-called red teams to advise government, to look at what government is doing and come up with contrary advice, to test out the advice they're getting, rather than just having these yes people surrounding the politicians.
Just a quick question, Rodney, about the CDC and its conduct during the last pandemic. Do you think there were lessons for them to learn?
Early on, I think what the American public didn't realize, and those of us who have been there or even worked in state health departments understand this, the CDC is not built to be a corporate reference lab that will crank out tens to hundreds of thousands of results. So I think one of the lessons that the CDC and the public needs to learn is that we must move quickly. Again, accurate diagnostics. I'm a medical laboratorian. You can't identify any changes in a virus or any other pathogen without accurate testing, accurate surveillance, and it needs to be as rapidly and as accurate and as real time as possible. It's a battle I'm really working at here in the U.S. as a science person, is to get that trust back, and it's going to be a difficult process because of some of these mistakes in communication.
Just a final question for both of you, just rounding this off, this program about Mpox. Tony Hinton, are you troubled by any aspect of how the WHO or indeed the media have covered Mpox so far?
Well, Mpox has been tried to be talked up to be the next pandemic, and it was tried again 2 years ago, and they've tried the same thing with bird flu. I'm not quite sure why they keep doing that. Even if we look at Africa, where the vast majority of these Mpox or monkeypox cases arise, there are much more important things. Clean water, malnutrition, malaria, TB are all more of an issue than Mpox.
Then what is your suspicion why they're doing that?
I've no idea.
Rodney, same question.
Yeah, I believe Mpox is not the next pandemic concern. I do believe we should watch all pathogens that are, changing and becoming different and how they might infect different populations. But I do believe that we have a much broader concern. And I'm going to go back to this idea of asking the right questions and determining the true, as best as we can, the true dangers that may come out of different countries, different places, different regions. And we have to get better at looking at surges in hospitals. We have to get better at security questions around certain events and what's happening on the ground. That takes a broad, fully funded effort at looking at better communication systems, both in the electronic health records, understanding what's happening on the ground. It's really difficult to follow a a global organization, whether it's WHO, CDC, or even a regional type of system that doesn't really understand what might be happening on the ground. So I'm always for better communication, better data, and other topics that we've discussed prior.
Rodney Roy and Anthony Hinton, thank you both very much for your contributions today. Much appreciated. And thank you at home and on your phones for watching. If you want to see this episode or any of our previous episodes, do go to our channel on YouTube. Just type in Nexus TRT World. Till next week then, goodbye.